Hit me. Welcome to the Stave Off Podcast, a part of the Senior Rehab Project. The Stave Off Podcast gives you the information you need to stave off illness and injuries, letting you live a happy life. And now your hosts, Nick and Christina.
Hey everyone, and welcome back to the Stave Off Podcast. I am Nick Previtt, strength coach in Beacon, and I am joined here by Christina Nowak.
Hi guys, how are you?
She'll be co-hosting, I guess, today. I bring her along for a ride sometimes.
Oh, he can get rid of me even if he tried.
And trust me, I've tried.
People don't know you. They don't know that you're actually kidding.
Anyways, today we are going to be talking about arthritis. It has a broad definition. There's so many different types. It can be really confusing about what you can do and what you can't do.
Yeah, I think that's a really great kind of summary about what we're going to try and do today. And as Nick kind of mentioned, arthritis is almost like an umbrella term for any type of condition that causes wear and tear on the joints in your body. And so we really commonly think about the osteoarthritis, which is the wear and tear that we see on the joints that are specific to certain movements that we do. An example would be, having a sports injury or,
Painter. We have a couple painters who have shoulder arthritis.
Mm-hmm. Yeah. So anything that causes, that's a really good example too. If
a lot of repetitive type movements.
Yeah. If your job is really repetitive, that can cause a lot of wear and tear in the joints. And so that's the classic osteoarthritis. But the term arthritis itself actually refers to about 30 different conditions who has a symptom that causes a wear and tear or destruction in the joint. And so I think a lot of the other common types of arthritis that we hear about are rheumatoid arthritis. Yep. And psoriatic arthritis. So if you have a skin condition called psoriasis, there's a small subset of people who end up developing a type of arthritis from that. And then you can also develop arthritis from gout. So there's a bunch of different types of conditions. And I'm sure as we keep going into the podcast, we'll talk a little bit more about that. But we really did want to kind of hone in on some of that osteoarthritis symptomology and things like that.
Yeah. So one of the first things I wanted to talk about was we have a lot of people come in and say, I had x-rays done of my knees and they showed I have severe arthritis. While something that can be diagnosed through x-ray.
Well, it has to be.
It has to be, but it's often not a good indicator of pain level.
Yeah. And so that's type of, I have to figure out how to word this properly. What the research has shown with arthritis, and I thought, actually, you know what, let me talk about an example. I think this will be the easiest. When I was a student, I did a 1-week placement in an area in a hospital in Hamilton called the Regional Joint Assessment Program. And so essentially what that was a place for people who may be considering joint replacement or who have had a joint replacement to come and meet with the surgeons. The physiotherapist would come in and do an initial assessment. They would do they would ask you how you're doing, what your pain levels are, check how much movement you have in whatever joint you kind of had arthritis in. And then we would check out the x-ray, talk with the surgeon, and make a plan from there with the person, the surgeon, and the physiotherapist. What we saw was so interesting because you couldn't really dictate it. Everybody coming in had arthritis, but some people would have arthritis that was worse on their left knee than their right, but their right knee was the most painful. I remember having one person who was so strong, so healthy, had an x-ray done of her knees. She had bone-on-bone arthritis. That's something we hear a lot about, and we should talk a little bit more about. But she was asking us why she was there, because she didn't have any pain. She had no discomfort. She had no issues with anything that she was doing day to day. And so there's a lot of variability. And I think we rely on pictures so much. And the more wear and tear you have on the x-ray, definitely the more likely you are to have pain and have issues moving around. But it's not necessarily the be-all, end-all that it sometimes can be portrayed to be. And that is a big deal with some of our clients, because they think...
Yeah, and it's almost a label too, right? As soon as you get that, you have bone-on-bone arthritis, that's scary. That is terrifying.
It's so scary, you're right, I know.
And then so people think, well, I have bone-on-bone arthritis, I need to start doing less.
Yeah.
And then the pain starts to come from there.
Yeah, absolutely. Yeah, so Nick actually touched on a couple of things. The label of having moderate to severe arthritis it's really terrifying. And as soon as you kind of have that label, you have this idea of what that means. And you're like, okay, well, I can't do anything because I have to get a joint replacement. That's the only thing that I can do. Yep. We have one client that we're seeing now who had that exact same thing happen.
Yep.
But she started conservative management. Conservative meaning, trying exercise or physiotherapy to try and improve her pain. And she's doing amazing. And she still thought that even though her pain was really low, if non-existent, that she still had to go for a joint replacement surgery. And so I had, we kind of had a really candid conversation and saying, you don't have to do this. This is not something that you need to do right now. Maybe down the road, if this flare-up comes back, or if it starts to degenerate a little bit more in terms of the level of pain or disability that you're having, then a joint replacement may be something that you consider more seriously down the road. But it doesn't mean, you don't need to have surgery as soon as you see that you have arthritis.
And it is better to put off these knee replacement surgeries and joint replacement surgeries while they are lasting 10, 15, 20 years. Think of if you're 55 and you get a knee replacement, the next time you go to have surgery, and it is a major surgery, it's very taxing on the body, the recovery time is long, you're going to be 75, and that is going to be a much lower likelihood of success.
Yeah, absolutely. Yeah, so you're right, the prosthetics that they're putting in the knees and the hips especially, those are the two most common type of joint replacements. Though I will tell you, I'm seeing a lot more, shoulder. You're seeing a little bit. I've seen an elbow.
You saw someone for the first shoulder replacement you've ever worked with. Or no, she was going to get a shoulder replacement.
Yep. And then I was actually working with an ex-CFL player when I was a student who had gone through a shoulder replacement surgery. And I'd never seen that before. And so it's still not super common. And the knees and the hips are a little bit more routine. The recovery time, we can talk about that a little bit more, but I feel like that's a whole other episode, a whole other can of worms to open up. But just like any surgery that you're having on a muscle, a tendon, a bone, anything, you have to be in hospital.
Yep.
You're going to be moving less than you would, which means that you're going to have some strength loss with that. And so, there's always those risks, like the risk of infection or the fact that the pain is still there, or, and I'm not trying to scare anyone away from surgery. I think that it's still a serious surgery. And anytime we have to be put under, it's something that we need to really consider and weigh our options. And I think the people who have a really open discussion with their doctor, with their physiotherapist,
and your family too. That's a big. It takes a lot because some people are having both their knees done at one time, right? And you need to be able to rely on someone to be able to take care of you for a while. You're going to be in a wheelchair. They're going to try and get you up to get you moving that day, but the recovery it's going to take your whole family.
Mm-hmm.
Everyone's going to have to chip in a little bit.
Yeah, absolutely. Absolutely. Okay, so let's talk about some of the management with arthritis.
Yes.
So we kind of went down the rabbit hole of joint replacement, and we could
I got Christina talking. What are you going to do?
Oh, yeah, right. You were talking to...
So, yeah, we want to talk. So, at our workshops, we usually take this in stages. So, we talk about what arthritis is. We go over a couple different types. And then we dive into, you have a flare-up. Say you walk too much or you slipped on some ice and now my knee or my hip really hurts.
Yep.
What are the things I can do immediately that will help kind of relieve some of that pain?
Yeah. Okay. So when we think about some of the classic symptoms of an osteoarthritis, we think about stiffness, pain, and swelling. And when we have a flare-up or when our arthritis is particularly bad, whether it be like Nick said, and we just did too much and all of a sudden our bodies are screaming at us. A lot of people with arthritis, and I don't think we really understand why, but the weather can have a huge influence. It could be anything that's causing that flare-up. We have two things. We have the immediate pain that we want to deal with, and then we have some of our long-term strategies that are going to help keep that pain at bay over the long term. And so I'm not going to really talk or touch on the medications. That's really outside of my scope of practice, but talking to your doctor.
And a whole nother.
Oh, you're right. That's a whole another can of worms. And
all right, so let's reel you back in here.
Okay, so acute.
So acute pain. This just happened. I can't get up, or it hurts to get up. What can I do?
Yeah. So there's a whole hot and cold debate. And so for arthritis, as long as there's not a huge amount of swelling that had just come up, I would probably use heat, just because with arthritis, stiffness contributes to some of that pain. Yep. I don't know if you've ever, if you sit in a car for too long, how that stiffness, it feels uncomfortable.
Or it's like if you've been on the couch, it's anything like that where you have to get up and you feel... Yeah, like you feel everything's just tight and stiff. And
it almost has this feeling of pain. And if you compound that on the arthritis, then some of that stiffness can really contribute to that feeling of pain. And so I like to have my clients use heat. The other thing is that activity, especially activities that do not reproduce pain, can actually be really helpful in that moment. And so for some people, just getting up and moving around and stretching very gently is a way to alleviate some of that pain almost immediately.
Yep.
Now, is that an all-out solution? No.
And not everyone's going to be the same in type of movement. So say your uncle, your brother tells you, well, when my knee starts to hurt, I get up and I go for a walk. That might work for him. That may not work for you.
Yeah, if walking hurts for you.
Yeah, it's trial and error, right? It's not everyone is going to be the same end all be all.
Yep, absolutely. And then if you're seeing a physiotherapist, some of the things that may work are acupuncture and ultrasound on top of exercise. So these are acupuncture and ultrasound work in the short term and help with pain. That doesn't mean that you should only use those. I think that you should be really trying to keep yourself moving and strengthening on top of using those modalities.
Yeah, so let's talk a little bit more about that, because that is a big thing, especially in the physio world right now, where a lot of people are they're almost gravitating toward one side. Yep. But like you said, it's in conjunction with. It's not one or the other.
Yep, absolutely. And so if I have somebody who's coming in who has a really acute bad flare-up and any movement is going to cause pain because there's a lot of swelling, or the arthritis is relatively severe, or they've been having this type of pain for a while, the use of things like ultrasound and acupuncture can help to kind of bring that pain down. Mm-hmm. And once that pain has come down, then we can start to really strengthen and stretch out some of the muscles, try and get as much movement into that joint as we can, and really try and strengthen in that range. And that, I think, is going to be the long-term strategy.
So is there anything I shouldn't do in the short term?
Oh, that's a really good question. I think that when we have arthritis, the really common phrase that we hear is no pain, no gain.
Yeah.
And sometimes that just isn't true.
Yep.
You're not trying to push through pain. I always think of the pain from arthritis as this threshold. You do a certain activity and you start to creep up and up and up towards that threshold. And if you continue working without a break, you hit that threshold and all of a sudden you have pain right now, and then you have pain at night, and then you have pain the next day, and it takes you out for longer.
Yep.
But instead, if you can, know that, say, I can walk for 15 minutes, then I need to take a break, and then walk for 15 minutes, then I need to take a break, instead of walking for 25 minutes and having pain for the next 24 hours, you can try and, figure out what your endurance is like and what your strength is like in that joint to prevent that pain from flaring up. And I think that's really important and really, really hard to do.
Yes.
Yeah, I can talk all I want, but when you're at work and it's hurting, like there's just nothing that you can do, and we have to be understanding of that, but trying as best you can.
Yep.
Yeah.
All right. So that was a short term.
Yep.
Now let's talk about long term. So we also need to think when we're talking long term that, say you've been on an exercise program for 4 weeks. You're not seeing, you still have the same joint pains. Everything's still just as stiff. Why am I doing this? They make me sweat. Ugh. So
not that we've ever heard that.
No, never. So we just want to make it clear to everyone that it's going to take, especially as we age, everything just takes a little bit longer.
Yeah.
So muscle activation around joints and everything takes longer.
Muscle strength development.
Muscle strength, and it all takes longer. We don't have the same hormones we did when we were younger. So
I mean, I'm not going to get jacked and ripped when I'm 80 years old.
You still might. We have a client now he's 63, and he's been coming to us now pretty steadily for about 2 months.
And he's starting to have those muscles pop for sure.
He's starting to. I see the thickness of his shoulders going up. So.
So the kind of important message with some of the exercise component. Exercise from the research has been shown to be really beneficial. Pool exercise as well, especially for people who are in a lot of pain. That's a great way to start.
Yeah, that's really early onset. Yeah.
Yep. But eventually you do want to be doing stuff that is going to strengthen the muscles on land if you can. And what Nick is saying is, the arthritis didn't take a day to develop, so it's not going to take a day to go away, especially when we're trying to really focus on developing the strength around the joint. If you're around me long enough, you're going to hear me say that your body needs to be strong enough to handle what you're asking it to do.
We're going to paraphrase this or put some parentheses around it.
I'm going to copyright it.
Oh, God.
TM, trademark. Christina Novak original. And, that strength takes time. Just like any athlete who's on a program is trying to gain strength, it is consistency and, perseverance and trying to really continue with the exercise. And then over time, you're going to start to notice that the pain comes on later, or I don't need to take as many pain medications. Or my favorite is sometimes I forget that I have it. And if I can hear somebody say that, I'm like, bingo. That's what we want. Like, we want to have those times where we aren't defined by that arthritis pain, or it isn't something that is really like almost deciding what we're doing. And for some people, unfortunately, that's the reality, is that they can't do it.
All right, so I want to dive into a little bit of this specific exercise. I don't want to go into them all because we just don't have enough time. But let's say I have knee arthritis.
Yep.
And I want to start to build up the muscle around my knee to reduce some of the pain.
Yep.
How do I go about that? Which exercise do I start?
Yeah. And so everyone is going to be a little bit different. The amount of movement that you have in your knee, how long you've had the arthritis, how strong you were to begin with, are all going to kind of play a part. But essentially, a lot of the muscles that you want to be strengthening are the muscles at the front of the leg, which is your quad muscle, the muscles in the back of your legs, which are your hamstrings, and your butt.
Butt?
I said it just butt. Like that. Absolutely. And I'm going to embrace it.
So why does strengthening the muscle around the joint reduce pain.
Yeah, it'll essentially it alleviates some of the pressure because it can take some of the load.
Yep.
Yeah, if you think about, how hard you're working, if you can lift 20 pounds and your groceries are 18 versus if you can lift 40 pounds and your groceries are 18, like that makes a
Even
big difference.
percentage-wise, it makes a big difference.
Yeah, you don't have to work as hard. You're not exerting as much energy. And you just are more capable of doing that before your muscles and your joints start to break down and scream at you. And so, yeah, that's going to be really important.
Yeah. I want to give everyone something very tactile they can do. So let's go over like the squat and how we would, if they were coming to see us at our clinic, how we would bring them through almost progressions and like signs for that so they can step up to the next type of thing.
Yeah, maybe we should do like a video series on that or something about how to teach the squat.
It's in our ebook.
It is in the ebook, but I don't think we have
I don't think we go through progressions.
And we don't go through like the cues and things. I think that would be something good. Stay tuned. That might come up in the future.
So the squat, very specific. Which joints do we specifically generally use it for and why?
Yeah. Squat, hips, and knees.
Yep.
Well, and a little bit of low back. Mm-hmm. Yeah, you get the stability part there for sure. The progressions that we do when we're teaching the squat, a lot of times if we have weakness, especially if we have arthritis, we tend to have a lot of weakness in the hip, whether it's arthritis in the knee or in the hip itself. And so we teach proper form, making sure that your knees aren't collapsing inwards, even when you're getting out of your couch seats or anything like that. And we'll start you from a higher surface. Well, we use boxes at the clinic, but even if you're around the house, a higher chair, because the lower your chair, the more bend you have in your knee and your hip, and the more strength that you need. Yep. And so we'll progress you from kind of a higher height and bring it lower and lower as we can within your tolerance. And then we'll add weight in different ways, either by making you hold on to a weight. We can put a barbell on your back. If you have other issues with your shoulders, we can put a weight vest on you. Yep. Different ways to add load. And the important part with any type of strength training program for arthritis is that you have to find it hard. Yeah. It has to be challenging because
we see a lot of people who go through, it's almost like they use it almost like it's yoga. They'll do like a breathe in, breathe out on the way down. They'll do 5 more. Okay, that felt good. While it is meant to feel good, it should still be challenging to you.
Yeah. So it's not just use it or lose it. It's use it or lose it, but challenge it. And so in order for your muscles to get stronger, we need to really, apply enough stress in a good way to force them to get stronger. And so I think that that's going to be something really important.
So some of the things we look very specifically when we're watching someone squat to a box or a chair or anything that they stop at a specific level. So I think one of the first things I look for is the knees, like you said, so that they stay in line with your toes and they don't kind of collapse in. And that they aren't almost falling to the box. That's another one we see very commonly when people first come in.
Yeah, especially because when they're going to sit, it's almost like, okay, I'm going to get some relief if standing for them is painful. Yeah. So they tend to flop. And we want to make sure that that doesn't happen.
So we think we almost want to squat down to the bench and just touch it. You don't want to fall. You don't want to sit. You just want to just give it a little love tap with your butt and stand right back on up there.
I love that he used the word love tap.
Little love tap, just a little one.
Yeah. And so talking with either a rehab professional or even, a fitness professional can help give you some ideas about what's going to be good for you and what's not. I think from a research perspective, we have a really good idea for people who have knee arthritis, hip arthritis, and low back arthritis, which is often also called degenerative disc disease. And that'll be a whole other episode. To be honest, from an exercise perspective and even from a rehab perspective, we're really bad about knowing what to do for our ankles. So if we have pain in our feet from arthritis, and also for the hands. a lot of times people will come and say, I was just told that I have to live with it. And unfortunately, there is just not a ton of research yet. And it's becoming a little bit more common. And
we see a lot more rheumatoid in the hands too.
Yeah.
Usually, yeah.
Yeah. But for some people who are like tradesmen, that's a lot of osteoarthritis as well. But yeah, so the exercise piece is going to be really important for arthritis. And I guess the only other message that I want to give, because I know we need to wrap this up soon, is sometimes we suffer in silence when it comes to the pain from arthritis.
Yep.
I know we've had a lot of our clients who are in our group programs who have said to us, I didn't realize that there were other people that look like me. And arthritis is...
And they can exercise in a, I don't want to say a supportive group, but it is a supportive group.
And in a safe way.
And in a safe way with people who are like you. No one wants to go work out with the athlete who's lifting 3 times as much as they are. It can be demoralizing.
Yeah, and it can almost make you feel like you have to do things that are going to hurt you the next day. And so, finding a program or finding even an individual program, a one-on-one, going to a physio and getting an exercise program, anything like that. But arthritis is extremely common. I think the statistic is 1 in 6 Canadians, and that frequency goes up as we get older, and it's expected to skyrocket. It's one of the most common conditions and one of the most common sources of disability with moving around in our society. And I know that that's just not just in Canada. I know the Canadian statistics, but I know that that's true all over the globe.
Yep.
And so, having those conversations, even with friends, and saying, I've been really struggling with my knee. And I bet that you'll have somebody who you thought had nothing wrong with them, who was like, yeah, my knees have been killing me too.
So I think we're almost out of time. Other than that, I want to say if you want to get some more specific information, you can download our ebook at www.staveoff.ca. I know it pops up on the homepage.
No, that's the newsletter.
Oh.
Yeah. So /arthritis. And we have a ton of resources on the blog too. We've done a lot of frequently asked questions about some of the things that we brought up today, and there's plenty of articles. I'm going to post a couple of them in the show notes to this episode. Yep.
Other than that, I think that's it. So.
Yeah. So I hope you guys enjoyed this episode. Keep following along. Please hit subscribe if you haven't already. If you have any feedback for us,
4-star review.
5-star review.
5-star review. The best there is. I'll just say the best.
If you like the podcast, we would really appreciate it if you could go over to iTunes and give us a review. That's how we can get on the new and noteworthy, and how we can kind of make sure that more people see this podcast and can follow along with us. So other than that, see you guys later.
Check us out at the blog and www.staveoff.ca/blog.
And we'll see you next time.
And have a good day.
Bye, guys.
Bye.
Hit me. Thank you for listening to the Stave Off podcast. Go to staveoff.ca to check out the show notes and more helpful content and how you can lead a long and happy life.